The next few weeks are going to be critical in Singapore's battle against Covid-19. Well, that's the message from ministers at a multi-ministry task force press conference this afternoon. And here's why. The number of daily cases has been rising over the past fortnight, from an average of 76 cases per day a fortnight ago to 288 cases per day in the past week. At the current trajectory, it's likely that we will soon reach more than 1,000 daily cases.
Our cases started rising sharply 18 days ago on the 23rd of August when we hit almost 100 cases, 94 to be exact. And from then, 24th August onwards, it's been rising at a very steep curve. As far as possible, we don't want to reverse course in our transition plan. We need to monitor the incidences of severe illnesses and deaths closely in the coming 2, 3, 4 weeks.
We also do not think it would be prudent to press ahead with any opening measures during this period, especially when we are in the midst of an exponential rise in infection cases. In fact, that would be a reckless thing to do under current circumstances.
Professor Teo Yik Ying is here to weigh in. He's the Dean of NUS's Swee Hock School of Public Health. Welcome back to the show, Professor. Today's COVID-19 Task Force press conference was the third in a week. Professor, what are your quick reactions to it?
Thank you very much for having me. So indeed, I think this has been a busy week for many of us, and rightfully so, given that we saw consecutive days where community infections were very high. In fact, the highest ever since the start of the COVID-19 pandemic about 20 months ago. And I think there is a need to address this directly, especially with respect to Singapore's plan to live with COVID-19 eventually. I think people will be wondering whether we should be worried with 400, 500 cases that are being reported daily, or whether this is exactly what we expect to see as Singapore gradually reopens. And I think the key to managing a public health crisis is always frank and consistent communications, so people understand what the strategy is and whether what is happening on the ground right now reflects what we expect to see as part of the game plan. So today's press conference, in my opinion, is a strong reminder that we are staying true to the game plan to eventually treat COVID-19 as an endemic disease. And I think Minister Gan said very clearly today that as Singapore reopens and more people start to move about in the community and going to work, the increase in COVID-19 cases will be expected. It's entirely to be expected. And of course, we would have hoped the numbers wouldn't increase so quickly. But given that what we've learned today, out of all those that were fully vaccinated and who subsequently became infected, 99.2% of them were asymptomatic or mildly symptomatic. And what that really means is that the vast majority of the fully vaccinated people who became infected never really progressed on to need intensive hospital attention. And this is exactly the signal to say we can confidently move along with the COVID-19 strategy. So I found today's announcement reassuring and consistent with the game plan for Singapore to become COVID-19 resilient.
Professor, let's talk about the rise in cases in just a bit. I just want to focus on something else first. The push for more frequent testing, especially self-testing. Now, households have their own ART kits now. Workplaces have testing regimes and so on. What do you make of the strategy to boost testing?
So we are certainly relying more on testing now, especially with the use of antigen rapid test kits. And these are the test kits that you can buy from pharmacies, from supermarkets, and what the government is distributing to every household. And actually, from a public health perspective, getting people to self-test, if they know they will be going to crowded public spaces where there may be a number of vulnerable seniors, or if they're attending large events, or maybe even before they visit a vulnerable senior, like their grandparents or great-grandparents, such self-testing is actually going to be increasingly important. And if testing more actually means that we are able to allow more activities to resume, then this is actually the kind of measures that we need to balance public health and the economy. And testing more should never just be simply to scare ourselves with larger numbers of infected cases, especially when most of these people we know, if they are infected because they are fully vaccinated, are going to be asymptomatic and they may not even know they are infected otherwise. And by doing so, I think we will actually reach that peace of mind that we are unlikely to be infecting the people that we care about as we move about with our daily activities. And I think moving forward, this personal and social responsibility will become increasingly important. That if you're in doubt, you self-test. If you don't feel well, or even just feeling a little bit sniffly, you self-isolate. And if symptoms persist, you see a doctor. All of this will really make the difference to reduce the amount of transmission happening in the community.
Professor, exponential. Now that's how the ministers described the recent rise in local cases after August 23rd, which saw 94 infections in the community. Now fast forward to yesterday when 450 local cases were reported. Now let's have a listen to what Minister Wong said.
All countries that open up have had to deal with such waves. For us, it is happening faster than we had expected. And it's also the first time since our opening that we are facing such a new exponential wave of infection in our community. Very soon we will reach 1,000 new cases a day. And in a few weeks' time, we will probably get to 2,000 new cases a day.
Professor, while the rise was predicted, the rate of it was faster than the task force expected. What factors could have led to this speed?
Well, the first and main reason is really the Delta variant. Because if you compare what we were allowed to do socially for dining right now with what we were doing in January to April this year when we were in phase 3, where we could dine out for 8 people, lots of activities in public spaces, including barbecues and camping in parks. We are actually much more restricted now than back then. And yet, back then, we never saw such sharp spikes in case numbers. And I think that's because we know our safe management measures work. And the strain of coronavirus spreading about in Singapore back then was not as transmissible as the Delta variant. So right now, almost all the cases that we see daily are caused by the Delta variant, and the way it spreads is much faster and of a bigger scale. And of course, the second reason is, again, quite straightforward, that we have relaxed measures so much more that people are moving about in the community, dining out in public spaces, returning to work. And actually, with most infectious diseases of this nature, with more people moving about and interacting, clearly much more chances for the coronavirus to spread. So really, Delta plus the fact that we are reopening is a perfect mix for the COVID-19 to spread fast in the country. And I should emphasize, this isn't just happening in Singapore. It's actually happening as fast or even faster in many other countries.
It is yesterday, 664 COVID-19 patients are warded in hospitals. Professor, we know we've spoken about this, while the focus should be on serious cases and those in ICU. But at this stage, Professor, at 664, shouldn't we also pay attention to all hospitalized numbers? After all, this would still strain the healthcare system.
Actually, yes, you are right. We should pay attention to the number of COVID patients in the hospitals. But provided they are there because they actually require the care and attention provided by a hospital. So Singapore all along has taken a very cautious approach towards putting many of the infected people in hospitals, including many who are actually asymptomatic or only mildly symptomatic. And I think this is why today's announcement, where they also talk about allowing the home recovery pilot now to be extended, because the findings have shown many of these people who are asymptomatic, mildly symptomatic, are able to self-isolate and recover at home, and they do not actually experience any negative outcomes along their recovery process. So moving forward, more and more people will be allowed to recover at home, even when they are infected with COVID-19. And I think this will then allow the hospitals to really focus on the symptomatic patients with COVID, and these are the ones who may have a real need for the kind of care and attention provided by hospitals. And Singapore actually put a lot of people in hospitals, like what we say, out of an abundance of caution. And I should highlight that actually many countries, including countries such as the United Kingdom, Japan, with comparable advanced healthcare system as Singapore has, actually they have been doing exactly that, putting their asymptomatic and mildly symptomatic cases to self-isolate and recover at home. So I think moving forward to a COVID-19 resilient Singapore, I expect more and more people will just self-isolate at home when they test positive. And I must emphasize, this is not compromising on the health and well-being of the people, but this is exactly the right sensible move, that we ring-fence and prioritize the healthcare resources on those that will truly need it.
Thank you so much for your time and your perspectives, Professor. I've been speaking with Professor Teo Yik Ying, Dean of the Swee Hock School of Public Health at NUS. Now, like what Prof. Teo just mentioned, the home recovery scheme to allow fully vaccinated COVID-19 patients with mild or no symptoms to recover at home will be gradually expanded to include patients up to 50 years old. This follows a successful pilot, and from September 15th, it will now be the default care management protocol for vaccinated patients.
We will move decisively on home recovery. This is very important so that hospital beds are allocated to those who truly need medical attention. And it's important, very important to do this when case numbers rise. Today, the large majority of infected patients are in hospital more for observation, and most are discharged uneventfully.
The Health Ministry also said today that parents are encouraged to have their infected children recover at home as long as they're at least 5 years old and don't have underlying illnesses. These kids will need to be assessed first by the hospital to be clinically fit for home recovery.